And this month, Maine became the first state to legalize buying prescription drugs from abroad. It is not uncommon for Americans to cross the Canadian border for cheaper medicine. And while the FDA would often turn a blind eye, it remained illegal until now. Well, as Don Dahler reports, some are wondering if a system meant to save money could actually come at the cost of safety.
For years, Robert Rosen received his cholesterol medication that would ordinarily cost $30 a refill for free. Rosen opted into a system that let him order the drugs from Canada.
I never had any side effects, so in my mind, they were all perfectly safe.
It was a partnership between the city of Portland and a Canadian prescription provider, Canarix. By sidestepping the prescription drug plan offered by his insurance company, Rosen was able to purchase prescribed medications from Canadian pharmacies at significantly lower costs. The city of Portland would cover the entire cost of his medication. In September 2012, then Maine Attorney General William Schneider halted the program following growing pressure from pharmaceutical companies. But local lawmakers concerned with the rising costs of health care stepped in, and earlier this month, they not only reinstated the practice, they made it legal.
It allows us to reinstitute a program that has been very successful in the city.
Portland Mayor Michael Brennan has been a major proponent of the law.
Cities, municipalities across the country are looking at ways to reduce healthcare costs. One of the most significant cost drivers within healthcare is the cost of pharmaceutical or prescription drugs.
Brennan says ordering drugs from abroad saved Portland employees more than $3 million from 2004 to 2012. The average American spends nearly $900 a year on prescriptions. That's down from 2011. But according to Canarix, purchasing meds abroad can cut the cost of each prescription by half. Still, the local and national pharmaceutical industry is suing the state over the ruling. They claim it's not just about losing profits, arguing the law puts Maine residents at risk of serious harm. Foreign drug companies are not monitored by the FDA. Though a prescription might be imported from Canada, production of that drug may have been outsourced by the Canadian company to a country with few safety regulations, and buyers may end up with counterfeit or dangerous medications. Safety has been an issue in the past. In 2003, Canarix was warned twice by the FDA for shipments of insulin that were not kept at proper temperature. They no longer distribute medications that need refrigeration. In a statement, Canarix told CBS News they have not heard from the FDA since, and they have never had a negative incident. But Kenneth McCall, a Maine pharmacist who opposes the bill, believes this is a bargain with too high a cost.
There's never been any oversight, and certainly it's easy to claim that you're perfect when no one's watching. But that's what we think is a significant public safety concern, is that there's absolutely no accountability in this bill, no protection for people in Maine.
Still, Portland has already reinstated the program, which could save the city and its employees over $400,000 annually. For CBS This Morning, Don Dahler, New York.